What's up, YouTube? I haven't done any videos about my back in a while, so I thought I'd throw one out there. We're in July 2024. Back update. As you know, I had the revision of the Fusion in April of 2023. So it's been a year and a few months. You know, they basically went in because the back didn't fuse. They went in, took out all the hardware, actually went in from the front, took all that out, put it back in, moved everything back. They actually had to use a vascular surgeon and the neurosurgeon. Sewed that up. I went home, I think, the day after, and compared to sciatic pain and the pain pre-discectomy, which re-ruptured, as you know, during COVID. They tried to do a fusion. It didn't take, but compared to that kind of pain, the sciatic pain where you can't sleep, can't walk, you're just miserable. You can't do anything really except lay in the bed and try to find a comfortable position. You can't sleep, walking through the house middle of the night. Anyway, the recovery wasn't that bad, but I'm able to walk a small mountain by the house 6 days a week. I bought as you probably know if you're following me, I bought or if you've looked at my videos, I don't really care if you follow me or not, but I bought a hot tub, cold plunge, sauna. But I just bought, a couple of months ago, I bought a Major Fitness Smith machine. You know, it's got the bench and the pulleys. I bought some weights from a different company because they were cheaper. I've been able to do, you know, basic workout. It was killing me when I was doing like bench press. Man, when I get done, my back felt like it was almost moved out of place. But I just eased in, very lightweight. Again, using the Smith machines, a lot of cables. Wasn't doing any leg stuff, no deadlifts. I did buy a leg extension, leg curl machine that I used some, and that seems to have...
Time, 30 minutes. Distance, 1.33 miles. Average pace, 22 minutes, 32 seconds per mile.
Sorry about that. I'm in the middle of, I do I don't know, 1 hour, maybe a little more, couple hour walk once a week. But anyway, I'm able to lift now, and I'm starting to lose some body fat, gain some, I think some muscle. I look leaner. I'm still around 200 pounds. But what I wanted to update was my back's better. I still think I have an issue at L5S1 that's never been addressed since the first MRI I had, which on the MRI, if you read it, it shows exactly what L4, L5 said, that I have a disc herniation, but it's never been addressed. My neurosurgeon, who I've used for all 3 surgeries, he doesn't want to just go in there and start fusing everything because he's worried about adjacent segment disease. So that's kind of been... Hello. Hi. I'm passing people, don't want them to think I'm talking to myself. Damn, here comes another person. So I felt, hey, pretty comfortable with his decisions. Got a runner there. So I may have to, like I said, I've been pushing my body pretty hard to see if that L5S1 gets worse or if it just kind of stays the same. Like I said, I've been walking fast up a 1 mile mountain, so up and down. It's a little over 2 miles, and my times have gotten better and better. Once a week I'll do an hour of just, I go start the same, and then I just branch off to this other little mountain and walk. But I'm not trying to break any records, but I will hit some zone 5 breathing where I couldn't talk or anything, but mostly it's zone 3 or lower, like right now, just to do something fun for an hour. But what I wanted to update everybody on was my wife around Christmas was moving some Christmas bins, and in doing that, she was like, man, my back is killing me, like the next day. Of course, I say, take it easy. What you don't want is, to mess up a disc. And she was bent over a lot while she was doing it. And, in like a closet we have that's got a low ceiling for storage. Anyway, it got a little better. Then it got worse. Then she started getting some pain in her right kind of hamstring butt area. And I said, you got to be smart about this. Don't do anything stupid. Try to just let it heal. Let's, let it calm down. Let's just, walk some. And she doesn't really walk this mountain with me. We walk when she gets off work around 4 p.m. We'll go walk a very flat area. But she started riding her Peloton again. She went for a jog one morning. And then about 3 days later, man, she could barely walk. So I told her, look, it's probably, based on where it is, probably L5S1. You gotta let it calm down. We went to a friend's wedding, and she was hurting. So when we got home, I did a telemed visit. Got a guy out of another state, and I get it, it's middle of the night. He just told her to keep taking Advil, Tylenol, Aleve, or whatever, which wasn't really helping. So I kind of had to advocate for her. Got in front of the screen, and I'm like, dude, can you give her a prednisone Meddraw pack?
Time 35 minutes. Distance 1.54 miles. Average pace 22 minutes 41 seconds per mile.
Because the Meddraw steroid prednisone pack is pretty much a standard that they give you when you go to anybody for a back issue. Well, he didn't want to give it to her. I kind of said, well, if you don't give it to her, I'm going to call the surgeon I use. I said, I've got probably 500 Percocet with Tylenol. I've got probably 1,000 muscle relaxers. I've got bottles of gabapentin because I never took them. And I said, she doesn't want to take any of that. She wants a Meddraw pack. Finally, he just said, okay, I'll do it. So he called it in. I went and got it that morning from pharmacy. She started taking it. You do like 6, 5, 4, 3, 2, 1. And that kind of took the edge off. She worked from home, but she was having trouble finding a comfortable position. She is able to sleep a little bit, but it wakes her up. She'll get up in the middle of the night and walk around the kitchen, kind of like I used to do after my surgery when I had a stint of real bad right leg pain, which again, I think was L5S1. I called the surgeon. He did the Meddraw pack for me, and in 2 days it knocked it out, and it hasn't come back that bad since. So I'm sure he just, those nerves were aggravated during the surgery, moving everything again, and screws and all that shit, cage. So anyway, that's where we are with her. I made an appointment with my back surgeon for her. We went in, and the PA saw her, physician's assistant. She pretty much said exactly what I said based on where it is. L5S1, probably a disc. I told my wife they're either going to say PT or MRI. I said, let's push for the MRI, and I told the doctor, I honestly don't think she could get in a position to do PT without damaging. She can't lay on her stomach. Like I told her to try to lay flat on we got a massage table. I said, try to lay flat on it and just put one fist under your chin and then eventually you try to work up. Well, she can't even lay on the table comfortably. She can't lay on her back comfortably. Her most comfortable spot is probably standing if she's moving. But it takes her about, 30 steps to get going because she's limping, and, anybody that's had sciatica knows what it's like. But she can get a little relief on her side with a pillow between her legs. But again, after a couple hours of that position, it gets irritated. So they did prescribe they said, okay, let's schedule an MRI. Insurance covered it. I took her that night at 8 p.m. The lady goes, yeah, it'll be about 15 minutes. And I said, no way. I've never been in one less than 45. My wife goes, well, that's what they said. And I said, well, hopefully they're doing an MRI, not a CT scan. I took her to the place. She went in. 12 minutes. She was done. She texted me, going in now, done. 12 minutes. I'm like, shit, I'm going to go get one soon just to see how my L5S1 looks. But anyway, apparently they have new machines that are, much better, quicker, scan faster. So that was good. So we made an appointment with the neurosurgeon in a couple of weeks. That was their first opening. If it gets worse, I'm going to call them, see if they have any cancellations or can do a telemed or something. Because I'm assuming the next step is either going to be injections or discectomy. And
time 40 minutes. Distance 1.76 miles. Average pace 22 minutes 44 seconds per mile.
If you can, apologize. But anyway, so she brought the CD home because they're going to send it over, but they also said, and they're going to have a radiologist read it, but they're also going to have, the doctor's going to want to pull it up and look at it. So I said, well, hell, let me put it in the computer. I've looked at enough. I've probably had 15 MRIs since, sports, and torn both ACLs, and, I've probably had, 8 to 10 on my back alone. So anyway, I pull it up, and the first thing I see is her, the spine. I can see the disc. They did do an x-ray at the doctor, which, it's just what they're going to do. They never find anything because they know it's soft tissue, it's not bone. So I pull it up and I start looking at the disc, and immediately I look at L5S1. Bam, you can see the disc is pushing to the nerve back there. Go Braves. Next year, maybe. Too many injuries, right? Where am I going? Okay. Kind of lost on this trail right now. Oh, here it is. So, yeah. So, you could definitely see a herniation. So, I have a feeling when we go in, the surgeon, and they gave her another round of the Medrol pack, or the prednisone, to hopefully knock out that inflammation. And I was telling my wife, it's not like Advil where, you know, it kills the pain. I said it goes in there and calms down the inflammation in the body around the disc. Maybe the disc calms down a little around that nerve, because that disc that's pushing in on the nerve that's what's causing the sciatic pain. So if you can calm that down and not do anything, don't pick up stuff, don't do laundry, don't bend over, you know, it may calm. And I think the human body, the way it's built, it usually works itself out. But, you know, like with me, it never got better. Injections didn't help. You know, if you follow any of my videos, nothing worked for me. We're waiting to see. But I have a feeling they're probably, if they think the herniation's really bad, they'll probably, like I said, schedule the discectomy, which is a little scary to me because my first discectomy never felt right. It didn't really work. I had a coworker who went to the same surgeon a week after me. She went dancing about a month later. She does this ballroom salsa dancing stuff. She's never had an issue since, except some numbness in one of her toes. Man, my back never felt right. I argued with him. I said, man, it's not good. It's going to rupture if I do anything. Oh, no, go back, do whatever you want. The very day I went back, I felt it. 3 days later, I sneezed and it popped, re-ruptured. Just like I said, they didn't want to believe me, but I always say, you know your body better than most people. But anyway, back to my wife. I'm hoping maybe they think an injection will help. But we're just playing it by ear. I'll probably update more on it. And yeah, hopefully she can get the relief that, you know, I never got. I mean, yeah, you get relief from the sciatic pain when you wake up from the discectomy, but you know, they have to cut through bone and lamina and different things back there, and that's the scary part. Muscle, things like that. I've seen a few of these guys online who say they can go in with this camera and a laser from the side of your hip, almost, or lower back on the side. They avoid all the bone, and they go in there and they laser.
Time 45 minutes. Distance 1.96 miles. Average pace 22 minutes 57 seconds per mile.
And they clean it up, pull it out, and again, it's only a small, you know, hole that they, you know, I don't even know if they stitch it or glue it up, pull all that stuff out, but you're not damaging the bone. And if I could go back in time, that's probably what I would have done to begin with. But not many people do it. It's an out-of-pocket thing. And again, if my L5S1 gets really bad again, that might be an option. And by that time, you know, there may be, just like the MRIs have gotten better, maybe the surgeries for disc issues will have gotten better. But just, I'll probably update on what's going on with my wife. Maybe she doesn't like to do, she has no social media. She doesn't like to get in front of a camera. But I may see if I can get her to say a few things, you know, especially if she has to have surgery or injections. The injections aren't fun, you know, kind of hurts. But I guess we'll see what's going on. I'll try to update everybody. If you got any questions, again, I don't do these videos for money. I'm just trying to help anybody with back pain. You know, also do some migraine videos. If you have the migraines that, you know, you have the zigzags and the flashing. Been dealing with those a lot. But yeah, if you have any questions, let me know. Any advice, throw it out there, and we'll see what her journey looks like, and I'll keep updating on my back. But like I said, I can't really complain at this point because I'm able to do a lot of this stuff that I never thought I would be able to do again. All right, thanks.